the end of the lockdown period in the Northern Beaches, everybody in the Greater Sydney area, including the Central Coast and the Blue Mountains, we're asking you not to have more than 10 people in your home, in addition to whoever lives in your home, until midnight on Wednesday. Again, as a precaution, because we know that indoor settings in small areas actually exacerbate or accelerate the spread. So until Wednesday midnight, we're asking anybody in Greater Sydney, including the Central Coast and Blue Mountains, not to have more than 10 people come to your home at any one time. We're also going to put in a health order from tonight, which says for all hospitality venues, for all indoor venues, places of worship, can I say for all settings that went from 4 square metre rule to the 2 square metre rule, we're reverting back to the 4 square metre rule. So apart from your home, all indoor settings will now revert back to the 4 square metre rule across Greater Sydney only, and the Blue Mountains and the Central Coast. This does not affect regional New South Wales at this stage, but it does affect Greater Sydney, the Central Coast and the Blue Mountains area. So until further notice, we revert back to the 4 square metre rule in all indoor settings apart from the family home, and we also have a cap on those settings at 300. This is so that if there is a seating event, if there is someone who has the virus at any of these events, health doesn't have to scramble, you know, for hundreds and hundreds and hundreds of people. We know that there'll be a maximum of 300 at any part of a venue or any venue to make sure that health is able to get on top of the contact tracing. We know, for example, that the cases that have been the subject of the Avalon cluster essentially came from 2 events, a bowling club and an RSL club where there was activity. Now, in addition to those settings, we're also going back to no dancing apart from 20 in a wedding party for Greater Sydney, Blue Mountains and Central Coast, going back to no singing and no chanting, except for places of worship that were allowed up to 5 in those settings. So we've reverted back essentially to those settings. This is, again, to prevent there being any seating events outside of the Northern Beaches cluster. As I mentioned yesterday, and as Dr. Chant and the Minister mentioned yesterday, we do have people who didn't live on the Northern Beaches who came down to those events, who got the disease and went back home. And we're making sure that we do everything we can to stop them and their contacts creating any seating events in communities outside the Northern Beaches cluster. Again, I'm grateful to the people of the Northern Beaches in particular, but also people of Greater Sydney who both anecdotally and evidence-based, I know that so many of you cancelled arrangements you had last night, have cancelled arrangements you had in the next few days, and we deeply appreciate this. If we continue to work together and we see things improve, obviously we'll be able to reassess these settings moving forward. I will confirm that the health experts and others will advise government Wednesday morning as to these settings and what we do post the current designated lockdown period. So on Wednesday morning or Wednesday during the day, I'll be able to communicate to the people of this state what the settings will be beyond midnight on Wednesday. And I'm hoping certainly that we see things improve, but there's no doubt that having an additional 30 cases in the community is a concern. But I also want to take this opportunity to thank Dr. Chant, the health team and the contact tracers to be able to get on top of, since 8 p.m. last night, 30 new cases and confirm that 28 of them in their source, plus know that the other 2 are from the Northern Beaches, is an amazing job. To be able to do that in that amount of time just demonstrates the capability we have here and the people in whom we have our absolute trust and confidence. Again, I thank everybody for your patience. I think this is the last thing any of us wanted this time of the year. But as we know, we're in a pandemic and all of us have had to make changes. We're all in this together, and I have confidence we'll get through this so long as we all stick together and stick to the advice that's been provided. Dr. Chant will now give her medical update. Minister Hazzard will reinforce some of those restrictions in place, but also include some more information about the Northern Beaches, and then Deputy Commissioner Warboys will just talk about compliance. Now that we have health orders in place, police will obviously have a more visible presence to make sure everybody does the right thing to keep all of us safe. Dr. Chant.
So as the Premier indicated, of the 30 new locally acquired cases to 8 p.m. last night, 28 of the cases are locally acquired and linked to the Avalon cluster. We're having ongoing investigations in relation to the other 2 cases, but they live in the Northern Beaches, very close proximity to many of the sites in Avalon, the centre of the clusters. In terms of the COVID cases linked to the Avalon cluster, have visited many locations throughout Sydney, and I do urge residents across the state to monitor that website. Obviously, for those sites that have had good records, we will be contacting you through the usual means, but please take the initiative. If you've been out and about, please check that website regularly. We've also updated our guidance in relation to a number of venues, and you can imagine that as new cases come to light, we have to change that. So again, if you've looked at the website, please keep refreshing your views because new information comes to light. So in relation to the additional confirmed cases associated with the Avalon Gym, anyone who attended the Anytime Fitness on Avalon Parade any day on or after Tuesday the 8th is considered a close contact and should get tested immediately and self-isolate for 14 days after they were last at the gym. And anyone who attended the gym between Monday the 23rd of November and Monday the 7th of December is advised to get tested and self-isolate until they receive a negative test. Now let me just explain why we've got those. That last statement I made about those individuals getting a test and self-isolating, that's because we're actually doing upstream testing. So we're looking at potential sources, and hence we're asking anyone who attended the gym between Monday the 23rd of November and Monday the 7th of December to get tested and self-isolate until they receive a negative test to assist us with our investigations and control of this outbreak. There is also updated advice in relation to the Avalon RSL Beach Club. Anyone who attended the club at the following dates and times is considered a close contact and is required to get tested immediately and isolate for 14 days. So that's Monday the 14th of December from 5 p.m. to 10:30 p.m, Tuesday the 15th of December from 12 p.m. to 5 p.m, and Wednesday the 16th of December from 4 p.m. to 12 a.m. So I would like to acknowledge the cooperation of the RSL, and they have got very good records, so we will be using our usual protocomming and then contacting people. But again, we urge people who are close contacts to immediately self-isolate and follow that advice. It is important that whilst we have a strong focus on the Northern Beaches, it is important that we remain vigilant across New South Wales. We know people from the Northern Beaches may have travelled since this outbreak emerged, and the Minister will be announcing that those individuals are expected to comply with the same requirements as Northern Beaches residents are required to under the sort of stay-at-home orders until further notice on Wednesday. But it is important that we detect any seeding events, and remember we also haven't mapped out the exact path by which this infection seeded the Northern Beaches. So because of those levels of uncertainty, it is critical that anyone with symptoms across New South Wales presents for testing if they have the most minor of symptoms, and also that everyone plays their part by monitoring the website, and if new sites come up, please follow the public health advice.
Good morning, everybody. I'd like to start by thanking the Northern Beaches residents, of which obviously I'm one. The response to the government's request has been extraordinary. Certainly the increases in the use of masks across the Northern Beaches has been very, very good. I would like to indicate, though, that across the whole of Greater Sydney, it would make a lot of sense for people to be wearing masks at the present time. Greater Sydney includes obviously the Sydney CBD, the Illawarra, Shoalhaven, the Central Coast, and of course the Nepean Blue Mountains. You will certainly, I appreciate there are some people who cannot wear masks for various health reasons, but certainly I'm asking, and the government is asking, all residents of the Greater Sydney area to wear masks, at least for the next few days until we revisit this issue on Wednesday. But it may well be wise to wear those masks going through Christmas and New Year in the Greater Sydney area. Can I also just stress that there has been a lot of reports on the northern beaches effectively playing the blame game, blaming individuals who are considered to be people who may have brought the virus in. Can I just remind the community on the northern beaches and indeed across New South Wales that at any time, any of us could be vulnerable to this virus. It is an extremely dangerous virus. There is absolutely no evidence to indicate that any person deliberately, knowing they had the virus, came into the northern beaches. And of course, that's really disappointing because people need to understand that it could be any one of us who has the virus. But if we take the necessary measures that we're advising, then hopefully we will all stay safe. I would say to my fellow Northern Beaches residents, don't play the blame game. Just listen to the orders that have been issued and please stick with those orders. Effectively, stay at home unless you have any of the designated reasons. And of course, one of them is work, 2 is education, 3 is the health issues, and 4 is compassionate grounds. But if you can, stay at home. I also want to add to the broader community, and indeed I'd say that this applies right across New South Wales at the present time. If you can, avoid visiting any of your more vulnerable family or friends in aged care facilities, in facilities that provide accommodation and care for people with disabilities. Our most vulnerable need our greatest protection. So please make sure that you think about that. I know we all want to visit our family, we all want to visit our friends who are in aged care facilities and facilities where people who have disabilities may be living, but the best Christmas gift you can give them is to make it a phone call. Don't actually visit them for the present time until we get this issue sorted out. Finally, I just want to say that as of midnight tonight, there will be new orders that will be signed by me under the Public Health Act. They will reflect the government's advice, and that is that there should be maximums, clearly, of 300 in indoor facilities and churches, and or the 4 square metre rule will apply, so it may be less than 300. And of course, it will be crucial that those orders be followed. Singing and chanting. I've had so many requests in the last few months. The government has had so many requests asking to facilitate singing, and of course we want to do it. It's the season when we would all love to be singing, but I've just got to say, for the moment, it's probably one of the most dangerous exercises you can do, dancing and singing. And if you needed to be reminded of that, just watch the video from the Avalon RSL. When people are out enjoying themselves, unfortunately someone was amongst them who had the virus, and so many people have now got it. Hopefully that is a message to all of us that singing, the aerosols that come out when we're singing, and dancing because we get so close to each other, it's a huge issue. So I'm just asking the community to stay on board with us, and I think that actually applies, it should apply to all of us no matter where we are. Whilst the orders that we made tonight will apply to Greater Sydney, I would say to folks right across New South Wales, take care, take caution, and if you can avoid the singing and avoid the dancing, do it, because that may well keep you and your family safe. Thank you.
Thank you, Minister. Premier, Dr Chant, good morning. Overwhelmingly, the people across the northern beaches, since the public health orders came into existence, have behaved well. Police have had little calls in relation to people going outside those orders. Over that time, police responded to 12 incidents. All of those were minor in nature, people that were fishing on the wharf that needed to be reminded to go home, people that were stopped in a motor vehicle on Mona Vale Road that weren't aware, apparently, of coming into the northern beaches, were turned around and sent home. So minimal response in terms of people outwardly and openly breaching that public health order on the northern beaches. But the message is that police will continue to be very visible and very apparent in those places where people congregate, particularly vigilant around the businesses, the licensed premises. It was a good effort combined with the licensed premises, the clubs, the restaurants in the northern beaches overnight, but as we move to other public health orders for Greater Sydney, We will need to make sure that people understand those public health orders and they comply on every occasion. The Premier and others have said that complacency, people who want to step outside of public health orders, are not only the greatest risk to themselves and their families, but to COVID spreading and getting back to a situation where we certainly don't want to be. I want to thank the people of the Northern Beaches for their efforts at short notice, but I also want to remind people that there are fines of $1,000 for an individual and $5,000 for a corporation, and if we choose to put someone before the court, that doubles. And we won't hesitate to use those where we have people that are clearly breaching and blatantly refusing to comply with public health orders. I would like everyone to heed the warnings. I would like everyone to make sure that they contribute to what we hope is a space where we can contain this cluster and everyone can get back to a normal piece of living as quickly as possible. Thank you.
Premier, how worrying is it that New South Wales has still not found the source of how this cluster started?
Oh, look, of course it's a concern to us that health experts are yet to identify how the cluster was transmitted into the community or how it started in Avalon, and we certainly will get to the bottom of that. But what is most important and most critical is for us to respond in the appropriate way, and that's why we're so pleased that the vast majority of the community on the Northern Beaches have embraced what we've asked them to do, because it's in the interest of their safety, in the interest of the safety of their loved ones, and I'm deeply grateful that so many people have come forward for testing. But what I'm also extremely grateful for is it's been a massive effort that we've been able to receive so much detail about the venues where these people who've had the disease or have the disease have visited. It's really pleasing to know the level of detail that we have this morning from cases that were identified to 8 p.m. last night. Now, this is because we do have an outstanding contact tracing team, and if anyone can get to the bottom of this, it's our team. But what is most important is for us to act in an appropriate way to try and stop the spread as much as we can. And certainly, there's only one bit of comfort we can take from the figures overnight, and that is that there isn't at this point in time any evidence that there's been massive seeding outside of the Northern Beaches community, and that's how we want to keep it, which is why it's so important for those of us who don't live in the Northern Beaches to also adhere now to the new orders that will be in place, but also to the advice that you really shouldn't be leaving home, although it's not mandatory outside of the Northern Beaches. You really shouldn't be leaving home unless you have to. You shouldn't be mingling with people unless it's absolutely necessary. And you should also cancel events, as many people, including myself, have done in relation to eating out or having those events which are deemed to be essential. This is a precaution, but an important one. We will be reviewing how the figures go the next few days, and clearly reviewing Wednesday morning what we do post midnight on Wednesday, and that is up to all of us to stick together, to do the right thing and to keep each other safe. Can I also stress, as Minister Hazzard said, if you live even beyond the Northern Beaches, for those indoor settings in particular we've identified, you should be wearing a mask. If you're going grocery shopping, wear a mask. And can I stress, there is no need, absolutely no need, to panic buy. Supermarkets and places where you need to pick up essential things will continue to remain open no matter what, whether it's the Northern Beaches or outside the Northern Beaches. Can I please stress that? But if you are going grocery shopping anywhere in New South Wales, please wear a mask. If you're going to a place of worship anywhere in New South Wales, please wear a mask. If you're going into an indoor setting or anywhere where social distancing can't be maintained, please wear a mask. Obviously, if you're going exercising with your household group, etc., that is not necessary. However, in those settings where we've said you should be wearing a mask, please do so, because as the Minister foreshadowed, we will be going down a firmer path if we see little evidence that that's occurring. And for heaven's sake, do not get on public transport unless you're wearing a mask. I can't stress that enough.
Premier, is the government in a position to deny the possible source of this is a wealthy couple who flew in from America and was given an exemption from local quarantine?
I do not know. Any health experts haven't been able to identify to me what that is. I might ask Dr. Chant to provide a comment around that, given the health experts are the ones that are in the best placed to determine how the source of that infection was.
Have there been any exemptions from hotel quarantine you are aware of in the past couple of weeks?
None that I'm aware of.
Can I just say that we've updated you with as much information as we know. Obviously, we've done an extent. What we know is that this sequence from this strain that is associated with this cluster is most closely linked to a return traveller from overseas who arrived in country on the 1st of December. Now, it is important to know that we don't know how common that strain is. So, just as anyone, there were very similarities in our strains, we don't know. So obviously we are testing all of the returning travellers from overseas, and we're accessing international databases to get some idea. But you can imagine in some of the countries like the US, genome sequencing isn't their priority given the number of cases they've got.
Dr. Chan,
so at
19 days ago, has anybody who
So-
has been given an exemption
so
been
there
found
is-
to have COVID
there is
in their
no
own home?
there is no one other source. There is no one else that we have identified that could be the source. At the moment, we are forensically looking at all of the journeys of that individual to see if there were any points associated with it. I think I spoke at my press conference yesterday about the fact that we've been testing people in the vicinity of that person in terms of, cleaners or anyone that might have cleaned a room after the person left, for the utmost of precaution to just check whether they could have been the source. Can I just say there is an intensive investigation underway, and whilst I really do want to find the source, it may be that this is going to be a challenge beyond us, but we are doing everything we can. Even today's announcement that we've asked people at the gym to come forward for testing is part of the detective work, because we're trying to find the earliest possible case and then link that back to anyone that may have come in contact with this individual. But we don't know it's in relation to this individual. We have to keep an open mind because there may yet be an unknown source. We have been very transparent with the information available, and that is the most up-to-date advice.
How transparent are you with who is exempt? Because we don't know who is exempted. There are people other than the airline staff who are exempted. You're not transparent.
So no one has tested positive in that area. So all the exemptions have been reviewed, and there are no exempt return travellers that have been brought to my attention that have been tested positive.
Just in terms of your working theory, apart not to Avalon, it's still gracefully centred on the gym. Do you think that was possibly the first case on the beaches?
No. At the moment, we are obviously looking for cases that have the earliest symptom onset, because that means that they're probably the first cases. There's often challenges with that because, as you know, there's variable incubation periods. So we are doing upstream testing. We're trying to look and cross-match any list, look for any people that may have been associated with anything to do with airports or quarantine facilities. The investigation's far-ranging, and we've got a dedicated team and assistants looking at CCTV footage. We are being as thorough as we can. But whilst our major focus, we're doing that piece of work, but to be perfectly frank, our focus now is also just as avid on trying to lock down this and control this cluster.
Do you think there could be a airline crew that maybe came in on the same flight as this woman who's in hotel quarantine?
So all of those investigations are incurring. We know that she was infectious on the plane. Contact tracing occurs around that case. So we have set up a team, and we are following up we've probably got, at any one time, 10 or 20 lines of inquiry, and we're pursuing all of those concurrently. So there is no one that wants to get to the bottom of this more than myself, because if I understand the clear chains of transmission, I can then better inform government about the risk. The problem we've got at the moment is that I don't know how it got there, so I don't know the person, I don't know where that person has been, and I don't know whether there are any undetected chains of transmission in the community. So that is why, whilst we have a strong focus on the northern beaches, it is essential that we take this seriously across the state of New South Wales, that everyone needs to play their part and get tested if they've got the minor itchy, scratchy throat or any symptoms whatsoever. and that they need to monitor that venue board, and anyone particularly that's been to the Northern Beaches, we want you to be watchful of your symptoms.
Mr. Hazard, let me ask the same question of you, please, sir. Same question. Have you given any exemptions to any or any minister you're aware of to any overseas traveller who is not in that core group, such as flight attendants who would normally expect an exemption?
Of course, there are exemptions that have been granted by health and by me to, as we talked about earlier, to people who have, for example, medical issues, people with children with disabilities, people who have come in and complied with all of the requirements, but nevertheless provided the thousands of jobs that have helped us get here. But there has been absolutely no case. I know what you're asking, but there's been no case whatsoever of any positive case from that process. It's all been done extremely carefully. Sorry.
Do you exempt wealthy political donors and people who are close contacts?
No.
That's a fair question.
Sorry. Well, it's a silly question,
But who do
actually.
you exempt?
I've just said to you, we have exempted, as has applied across the country, people who have, for example, brought in all the jobs that we're doing, but they don't get exemptions in the sense of self-quarantining. They get exemptions to perhaps isolate, to quarantine in different environments, still with police protection. So I don't think that's what you're talking about. But we have exemptions for people who might need to go to a funeral because their mum's dying.
Do you exercise any discretion based on who your mates are or who are wealthy? I mean,
Sorry, that's just a silly question.
It's
Of course not.
silly,
It
Brad,
is.
at all. You know
Of course that's not the
I've
case.
spoken to hospital staff.
It's not the case. Yes, sorry.
Being as we still haven't gotten to the bottom of it, how confident are you that this isn't going to happen again?
We're not. And obviously that's what Dr. Chant is saying, that the tracers that have done their job, particularly in the last few days, have done an extraordinary job, some of them working right through the night. And of course when we get these late cases coming in, as the Premier said, by the morning we have a good indication of where they've been and what they've done. The only missing link here at the moment is who was the original source of that overseas virus. We've talked about this before, that there was one passenger who came in on the 1st of December, and because of the incredible capacity of our pathology and tracing teams, we know that the genomic sequencing has indicated that person had a genomic sequence that was very, very close to the cases that were occurring, the source cases, or the course of cases in Avalon. But we just don't know how it got there. That's the issue. Sorry, one at a time.
These restrictions that you've imposed today go far enough. There are calls to look down all of Sydney, seeing as we don't know where the source of
It's always, everything that's occurred in New South Wales right from the word go has been the risk balance. And we will continue to do that. I think that you can safely say that New South Wales has led the country both in keeping jobs, therefore keeping mental health, keeping the economy moving, but also keeping people safe. So I'm quite confident that we have, as I've said on a number of occasions, diamond level health tracers, and I think the work that we've done over that period has been a very balanced way of approaching this. And look, the Premier and I and Dr. Chant have said right from the word go that there is very likely to be breakouts from time to time. We are in a worldwide pandemic. Every day for the last few weeks there have been 3,000 people die in America, many thousands more dying in other countries across the world. Until we get a vaccine, we don't have a solution to the problem. We can manage the problem, we can risk manage it, and that's what we're doing.
Dr. Chant.
Sorry, somebody else. Sorry, you want to ask me or Dr. Chant?
I'd just like to know, Dr. Chant, what would it take for us to be able to celebrate Christmas with more than 10 people when you make that decision?
I think, as the Premier said, those decisions will be, we'll consider an update on Wednesday for the community. I think
you must have some...
Well, let me tell you about some of the things that would elevate my concerns. So if we end up seeing greater seating events outside the Northern Beaches, that would be of concern. So if we start to see an increase in unlinked cases, and particularly if they're spread outside the Northern Beaches, that is of concern to me. So we are closely monitoring the situation. I get almost minute-to-minute updates of every new case and whether they're linked and what the source is. We're assessing the risk at all times, but I think it is important that we work together at this point in time. We know what we need to do, and that is about limiting our movements, limiting our contact, wearing masks when we're indoors in those environments, as the Premier said, shopping, any time that we're in an indoor space, because we know that represents the greatest risk. We're advising not to sing and dance, and I know that sounds party pooperish, but we do know that those behaviours are likely to bring people in close contact and facilitate a seeding event. What we are trying to do is limit further spread of the virus or further large-scale seeding events, and that presents more challenges for us for public health contact tracing alone, and that is why the restrictions have been put in place to give us that breathing space whilst we assess it. Can I just say that the information evolves, and I think we need to be responsive to that evolving information. But the general factors that we take into account is whether we're seeing cases outside the Northern Beaches and whether they're linked or unlinked, and then whether they've been out in the community and having other exposure events. My desire would be to see that the majority of cases are occurring in close contacts of cases and that they've already been in isolation. So it is important to say that we will be expecting more cases, because remember, we always have a tail where the cases have become infected and they've usually already been in a household setting. We know the risk that that household setting applies, but remember, we've already locked down the household contacts and cases.
You mentioned
how many of
November
today's
20.
cases, Dr. Chan, how many of today's cases are close contact of other cases, or did the infection occur at the Airline Polo or Airline?
So, as we indicated in the briefing in the numbers, 28 of the 30 cases are linked and 2 others were resident in the area, in the close proximity to Avalon.
Of the 28, are they household contacts of existing cases, or did they get it in the Polo or after?
They're linked either directly. We'll have to just take the breakdown of that. The reason this becomes a little bit more complex is that people in the community actually go to multiple venues, and so it's important that we don't actually attribute blame, and that's why the numbers get very messy, because people don't just go to the bolo, the RSL, they go to the the fish shop, the gym, and it gets a bit messy with the numbers. But all I can say is that they're linked either directly or a contact to the case that we're
You mentioned December 1, but we're going back to November 23 for the gym.
That's right.
We think that the person with the virus went to the gym in November 23.
We don't think that's a high probability, but you'd expect us to be thorough. We always explore all options, and you can imagine that that is 14 days from the person's potential infectious point. So it's just routine. It's not what we think at the moment. I did provide advice yesterday that our sewage surveillance for that area was negative on the 10th of December. Now, while we always have to have caveats around those sorts of findings, it does give me some confidence that there wasn't widespread transmission occurring in the Northern Beaches on the 10th of December. It has subsequently turned positive, and I expect it to remain positive for a long time, given the number of cases in that area.
Dr. Chan, just around your thinking, the health advice you gave in terms of restrictions, because I think there are concerns that perhaps they're not hard enough, and I think people are concerned about this turning into a Melbourne situation. Can you just explain why you've only gone so far and not made masks mandatory as well?
I think that the restrictions and the approach, I think the Minister has addressed that in his previous response. We all have a part to play in how we respond to this, and so often the actions we're requiring people to adopt require people to cooperate, and I've got to just express my gratitude to the population of New South Wales. Yes, there was a drop-off in mask wearing, but even when I've been driving, I've seen incredible increase in mask wearing. People have sent me photos of supermarkets where vast majority of people are wearing masks. So I think that we have had a lot of cooperation from both the community and business, but we will use all, we will use all strategies to bring this virus under control. But ultimately, it is also the hands of the individuals within New South Wales.
Premier, why has it taken so long, Premier? Why has it only taken until now for you to impose stricter rules for foreign airline crew coming into New South Wales, given the higher risk that foreign airline crew can have the virus and spread it into the community?
James, we addressed, the Minister and myself addressed this matter at length at yesterday's press conference at length. If it was easy, we would have done it. It's been a very complex process, but I'm pleased the process will commence from Tuesday.
You said that you didn't have jurisdiction over the airline crew at the media conference on Friday. That's not correct.
Well, it's a very complex area and it does require separate discussions. I might ask Minister Hazzard, who's been dealing directly with them, to answer those questions.
Right from the word go, the terminology is a bit unclear there, James, but right from the word go, there's been international conventions across, obviously, the world, and reinforced by all governments in Australia, that there were challenges about air crews coming in and out, and we've actually worked that convention, but it essentially meant that the air crews were supposed to be self-isolating for a period of 24 to 72 hours, here, but also in other jurisdictions around Australia and indeed the world. What we have done now is said here in New South Wales, in a sense we're stepping way in front of any other state or territory, and indeed it may, I'm already hearing it has implications internationally, because the air crews are saying in some instances they don't accept that they should have to have this higher level of, in effect, not just self-isolation, but let me finish, James, but quarantining. So as at the week before last, I and New South Wales Health had more than an hour's discussion with quite a number of the airlines, and we had another one on Thursday or Friday, and we indicated to them that we felt that even though there were international conventions and an understanding across Australia, that we thought we should move further. I've spoken to a number of the other ministers around the country and indicated that I think that if we move the way we're intending to move as from Tuesday, that should be considered by all other states and territories, because clearly there has to be a similar rule across the country. And some airlines have indicated, well, we may not be interested in coming into New South Wales anymore. That's an issue that we're hopeful that will be resolved by all other states and territories adopting whatever new measures we put in place.
Thursday,
Last question, please.
is already doing this. On Thursday, Mark McGowan said that he's already putting flight crews into quarantine when they come in. But you've been trusting airline crew not to breach self-isolation.
I can't comment on what Mr McGowan's saying, but I can tell you that that's the arrangements across Australia. Could I just add something else before a question that was asked here, I think, about the exemption process? Can I just answer and clarify, just in case you don't fully...
My next question,
Oh, good. I'll just explain. Right from the word go, there have been cases, very early on we realised that there had to be, in all states and territories do it, that there had to be some sort of exemption process, particularly for people coming in, say, with, as I said earlier, a child with a disability, people who were coming in from Victoria, forgetting not that we had Victoria as well in other states where we had concerns, particularly Victoria. And so some of those exemptions around people visiting, for example, coming in at all into New South Wales and being able to go to a funeral. But each of those exemptions have been dealt with, and internationally applies as well. People who apply for the exemption go through a very rigorous process with New South Wales Health. As teams were established many, many months ago to look at those. But not one single case where there's been an exemption has actually resulted in a positive case in the community. Not one case. And everybody who actually has the exemption, even for example, I'm thinking of a family where they were in our health hotel, and there was quite a bit of media at the time about the fact that the health team had said they had to stay in the health hotel, and that then came as an appeal to me. And I remember looking at that with the health team again and talking personally to the family and saying that I would like you to have the same arrangements as you would have if you were in quarantine. So that family went to their home, but they then had both the day 2 and day 10 tests and were negative. And that's what happens. They still have the day 2 and day 10 tests. And in some cases, they also go the extra step of having police actually guarding the property and paying for that themselves, whereas most people who come into our hotels, of course, the taxpayers pick that up, so others have... Sorry. So only one no cases at all of any positive cases.
Do you have any way of knowing?
Sorry, James, one at a
Sorry.
I've got an easy question, got to be
time.
Just
Got to be
stats.
different, isn't it?
Just stats, Mr. Hazard.
Yeah.
Positive cases who were sick in hospital or on ventilators. Just those cold hard stats. Is there anybody on a ventilator in hospital at the moment?
I don't think we've got any, but I'll ask Dr. Chant. I'll ask Dr. Chant to answer that. I'll do mine and then I'll ask Dr. Chant to answer your question. They're going to come to you.
Okay, thank you.
Yeah.
Oh yeah, sorry. So, are you aware of a positive case attending one of our golf clubs? We
No.
understand a member.
Do you know, in the last few days I've heard... Oh, there is? Sorry? When?
It's not on
Okay, we'll let Dr. Chan answer that, because I wasn't aware.
Not on the list. There's another, like Narrabeen School. They've been told 3 days ago they've got an outfit.
Do you want to answer that, then I'll answer
Situation
James.
with 60 people in quarantine, told to quarantine and get tested. But it's not, I'm not having a crack at the New South Wales Health, but it's not on the list.
I'll let Dr. Chan, so I'll come back and answer yours in a second.
So some sites where we've absolutely got everyone don't go on there because the list is becoming so long that there's a balance between people actually being able to see the ones that need to be focused on as opposed to ones that don't. So that's a challenge for us with so many venues. So I'm happy to follow up that, but the only condition that it wouldn't be released publicly is where there's very clear records of everyone who was involved in that. I am aware that the Mona Vale Golf Club, I'm happy to get you the details about that. That came in, I would just have to check, but I was with the team when there was discussions about that. So I can get you the details. I think everyone's been doing close contacts and there's been work and engagement with that.
There's
I
never
suppose
been
it's
so
quite
many.
confusing for people who may have attended Mobile Golf Club and they've been informed by them to that's an isolate that it's not on the New South Wales Health website.
Look, sometimes there is a delay because on the website we want to just get the information about whether they're close contacts or others. And so I will just follow that up, but our aim is to be very timely in getting that information up. I'll just follow up on that.
There's been so many cases, places. We've got over 70 places where people have been since the pandemic began. In terms of individual clusters, have we seen anything like this before?
Look, I think also, can I just say that we've been very, and this is not in any way to mitigate the magnitude. This is clearly a concerning situation. We are also taking a very cautious approach with identifying venues, and that's something we've learnt because we don't want to miss and let any case escape our reach. And so we certainly are taking a very cautious approach to identifying venues, and our cautiousness has increased over the period.
Have you seen anything like this in terms of the spread?
Certainly it would be analogous to the concerns around at the Crossroads time. Remember we had many clusters popping up at that time across southwestern Sydney predominantly, but some spread into western Sydney and into Central Coast. There are many similar elements. To be perfectly frank, there seems to be still quite a consolidation of cases in a tight geographical area at the moment, but I've clearly expressed my concerns about the fact we don't know the exact pathway this virus got into the Northern Beaches. We don't know, and there have been some seeding events, and people have travelled outside the Northern Beaches. So for those reasons, we are cautious and we are asking the community to follow the public health advice and do the right thing so that we can control the spread.
Thank you, everybody. The question that you were going to answer.
Sorry, James. Yep. What was the question?
Does New South Wales Health or New South Wales have any way of knowing if flight crew have breached their isolation, given that they currently, or until the new rules come into effect, could go into any number of hotels at their company's choosing? Does New South Wales have any idea if flight crew have breached?
Well, the police have been doing their work, and there have been, I think, 2 instances where there's been, or 2 crews where there have been instances where the police followed up and actually charged them. So, yeah.
But apart from the ones
So the
we
police have
already
been
know
fine.
about, you wouldn't
Don't know any of those at all.
Thanks, everyone.
Can I just thank everybody? And can I just say finally, I want to say thank you to the Northern Beaches community. As I came here this morning, the queues again were out by 8 a.m. So thank you to all of my fellow Northern Beaches residents for going and getting tested. Any symptoms at all, if you've been to any of these facilities, go and get tested. We're very grateful for the work that you're doing in being tested. Thank you very much.